So very good morning, one and all who are watching this video. This video is mainly containing of the information related to importance of spinal exercises and its effects on normal aging. So usually I think the people who are watching this video, I know you are all the above 60 years of age group of people, and some of you will be having symptoms like neck pain, back pain, knee joint pain, and some of you will be just started having these symptoms, and some of you will be having already developed the symptoms, and you will be taking treatment of physiotherapy or some other different methods of management at different areas wherever you are living. But my intention of you people who are watching this video, and through this video what I would like to say is that, and how one should be normally aging, and how to take care of our health once we are crossing 40 and above. Actually the actual aging starts from 40 years and above, because if you think about the life span of a human being, till 30 years we can practice any kind of a newer activity. Our body can withstand the stress, and our body can learn the new methods of maintaining our physical health, but that can be sustained only up to 40 years. But after 40 you cannot go for any kind of a newer methods of management of physical health. So nowadays the people are very fascinated towards going to gym at the age of 40 years, 45 years, 50 years, and till 40 years the people will be simply doing their work, and they form a kind of a sedentary lifestyle. But once they come to know that the exercises are very, very important, but they realize it very late, and people go and try to use many avenues for exercises, like they join for the gym, join for the swimming, they start walking briskly. So these kind of things will definitely, instead of giving the good results, it is proven that it has given only the harmful effects to the people who start the new physical activity after the age of 40 years. That is why our physical health, whatever we wanted to do, however we want it to be, and we can practice our body till the age of 40 years. After that, we should sustain the same activity throughout our life. Suppose the people who are not done this kind of work and 40 years and above, still they wanted to be normally aging. So what should be the remedy, and how one should be? For all of your knowledge, so I wanted to tell you that in our body, the spine is very, very important segment. I don't know how many of you know it, but from the spine, that is from the spinal cord, the nerves are coming out for our hands and for the legs. So as long as the spine is normal, we all will be normal physically. So this is the physiology. I am talking in relation to physiology. I am not talking hypothetically at all. As long as our spine is normal, we will be normal. So but spine is the segment which always getting affected in the process of aging, or the first segment which is getting affected in the process of aging is spine. So what do you mean by spine getting affected? How the spine will get affected? When do the spine will get affected? If you ask me, spine will get affected when you overuse. Spine will get affected if you impose sudden stress to the spine. So this is very common at the age of 40 and above. So the spine, even because of the aging, because of the if it is a woman, or because of some hormonal changes, the bones gets weak, okay, and there is a deficiency of vitamin D and calcium, all those things will be there. So as a result of that, and the vertebra, that is the bones which are forming the spine, that will get affected primarily than that of any other segments in the body. So when a spine, how do we know if for individuals spine is affected? So you will come to know the spine will always create some discomfort, either cervical spine or the thoracic spine or lumbar spine. People will get a discomfort followed by pain, and followed by, if that is still it is been ignored, then they will started having some paresthesia, pain or tingling sensation, numbness, depends on the segment that is involved. So these kind of symptoms, and it is expected to come in all the people above the age of 60 years onwards. So I think the people who are watching this video, I know you are all very pioneers at your respective profile, but you all might have developed this kind of symptoms of a spine. So for this, the only remedy, that only suggestion that as a senior physiotherapist in this field, I can suggest to the public who are watching this video, is that if you make you aware of your normality of your spine, I assure you that your spine will be normal, and simultaneously you will be living your physical healthy life happily throughout. Even at the age of 90 years also you will be strong. So taking this in my mind, and I am being the head of the institution of Krishna Institute of Medical Sciences deemed universities, Krishna College of Physiotherapy, and being a dean of this college and having more than 25 years of experience in this field, and I thought of publishing this video for the welfare of the society, that people of who are normal, and how to be normal even after when they are in the process of aging. So this aging is in our physiotherapy language, we classify into two types: normal aging, abnormal aging. What is normal aging is nothing but, even though if you have crossed 60 years and your physiological functions are such that it is not keeping you or making you feel that you are aging. So that kind of a phase of your physical status, we call it as a normal aging. Whereas abnormal aging is reverse. It means even at the beginning of the 60 years, even some people well in advance, like in the 50s itself, they will be started having the knee joint pains and neck pains, back pains. If you go to the MRI, CT scan, there is changes in the spinal cord, changes in the knee joints. So this kind of, and they will have the BP, they will have the diabetes, they will have the all kinds of problem. They themselves will feel that they are abnormally aging. But the classical definition of normal aging is aging is, if you say, maybe I may talk in a medical language, but please, it is very simple. It is aging means the physiologically normal deterioration of all the functions of our body, which is which will keep the person within the normal limits. So no parameters will get vary when you say it is a aging means. So normal aging means within the normal limits जो आदमी लोग रहता है, they are normally aging. Those who have developed the significant symptoms, they are abnormally aging. So the solution for prevention of abnormal aging is that, well in advance, consulting a good physiotherapist nearer to your area, and consulting a good physiotherapist nearer to your area, and making that physiotherapist to assess your targeted segments of the body, especially the spine and the weight bearing joints. अगर आपने well in advance एक फिजियोथेरेपिस्ट का, आपका एरिया में जो फिजियोथेरेपिस्ट के पास जाके अगर आपने स्पाइन का evaluation, if you could have done, and the weight bearing joints like knee joints का evaluation if you have done, and if you have followed the advices of the physiotherapist, definitely you are going to be normally aging throughout your life. So out of these things, and I wanted to demonstrate some of the important aspects of or important exercises, preventive exercises for the people who are watching this, to considered to be normally aging. So in this video, I am going to concentrate only on the spine as an important segment, which I already told you why is the spine is important segment in our body, because from the spine only the nerves are coming out to the upper limb and the lower limb. As long as the mobility, strength and stability of the spine is normal, then the rest of the life the person is also going to be normal. So with this, I am going to demonstrate to people who are watching this video about what kind of exercises one should practice well in advance in consultation by not only I always sincerely suggest and advise to the people not to only blindly follow this. This is just to make you aware that this kind of exercises you are supposed to perform. Whether you are eligible to perform, that will be decided by your respective physiotherapist in that locality. Please go and consult your respective physiotherapist. Then you start doing this kind of exercises. He will advise you the better. This video is only for the purpose of making you aware that this kind of spinal exercises you are supposed to do, and this will be taught to you by, which will be tailor made by the respective physiotherapist in your locality, and then you are following these exercises, which is going to be useful. Now I will demonstrate you the exercises which you are supposed to follow when you are which you are supposed to aware that your body requires this kind of exercises for your lifetime. For that, and we have our own PG students who is helping me for the demonstration of these exercises. So spinal exercises always begins with the you always remember the exercises will be, all spinal exercises will be done in the lying position only. So when in the beginning we all will lie straight lying. So straight lying position is nothing but supine lying position in our language. So, and there are exercises in supine lying, there are exercises in prone lying, there are exercises in sitting, there are exercises in standing also. But primarily most of the spinal exercises will be covered in the lying position only. So these exercises who wanted to follow, as I already told you, don't follow it immediately after seeing these videos. After seeing this video, take the knowledge, keep the knowledge with you, make yourself aware, and then you go to your respective physiotherapist nearby. Sir, I am an age of 60-year-old, whether I can do these exercises, and I saw this video from an eminent personality from Krishna Institute of Medical Sciences, University of Karad, and you can tell them, and you can then that physiotherapist will assess you and they will tailor you whether which exercises are suitable among these various exercises. So I am very much particular in this regard, and you just so now let us go to the exercises what I am going to demonstrate to you. The first exercise is that always we have to relax the spine. It means the spinal segment, it should be relaxed. For this we will be teaching the person to do the deep breathing exercises. So deep breathing exercise is nothing but taking the deep breath in crook lying position, and he has to hold as much as possible. For the people who are less than 40 years can try to hold it for 60 seconds minimum. For more than 40 years, even 60 years and above, you can hold it for 30 seconds and hold as much as possible. Not only 30 seconds, you can hold it as much as possible and leave it through mouth, and repeat it for 3 to 5 times or maximum 5 minutes of deep breathing exercises as a beginning of this spinal exercises. So bend both the legs. Now we have to take, I am telling you to take the deep breath. Take deep breath and hold as much as possible. So minimum you can hold it for, he is a young boy, he can hold it for 1 minute and above also. We will make sure that he is holding it for sorry, 1 minute. So we have to take deep breath through mouth, through nose, and hold it as much as possible and leave it through mouth. Like this. This is how one should perform the deep breathing exercises as a beginning of the spinal exercises. for 3 to 5 repetitions or 5 minutes of whichever is longer you can try. After this, in the same position, we have to ask the person to do the pelvic bridging exercises. Can you do bridging? Demonstrate 3 times. Yes. So bridging is nothing but you have to lift the pelvis and keep it down. Lift the pelvis and no need of holding. Just keep it down. Yeah. Hold. Repeat it for 5 times. Yes. 1, 2, 3, 4, 5. Okay. This is called as pelvic bridging exercises. Straighten the legs. Then after this, our spine, we are divided into 2 segments. So that is upper back and the lower back. We always call it as medically. So upper back, whenever we are trying to do the exercises, first we have to complete the upper back related spinal exercises, then the lower back related spinal exercises, then we have to combination of upper back and lower back. Like that our protocol goes. So now once the breathing and bridging is over and we are making the, you should straighten your legs and relaxly, and the first exercise you should tell the person to lift the head and shoulder and see the toes. Yes. Keep the both foot straight like this. Down. Repeat it for 5 to 10 repetitions. Yes. 2, 3, 4, 5. This is the first exercise. This is for specially upper back. Then for the lower back, nothing but upper back exercises are when you accompany the movements of the upper limb, that is shoulder girdle, then that will automatically become the upper back. When you involve the lower limbs, that is going to become a lower back. Okay. So now it is simply I am just explaining to you all, those who are watching this video. Then after this, straight leg raising up to 40 to 60 degree only. Yes, lift, down, 10 times. 2, 3, 4, 5. Change that leg. 1, 2, 3, 4, 5. Then both legs. 1, 2, 3, 4, 5. Okay, now these spinal exercises, we are in our department for the people who are having symptoms like back pain, neck pain, जिसको already symptomatic individual है, for those people we always teach them graded spinal exercises. So we will not go directly all the grades. We will start from the grade 1. So in this position, the grade 1 is breathing, the bridging, then individual leg raising and the bilateral leg raising is the grade 1 of spinal flexor exercises. Then again grade 2 is there, grade 3 is there in the same position for the flexors. So grade 2 flexors, spinal flexors is it for the upper trunk. So you should make the person to raise the shoulders along with the 50% of the shoulder girdle has to be raised along with the head and trying to see the toes. Do yes. Repeat it for yes 5 times. 2, 3, 4, 5. For the lower trunk, it is bilateral straight leg raising only. Lift. Yes. 1, 2, 3, 4, 5. Then for grade 3 spinal flexors, all 4 limbs, head and shoulder and both the legs. You have to repeat, raise it for 5 times. Yes. 1, 2, 3, 4, 5. So this is the exercises in supine lying position. The exercises in supine lying position mainly exercises the trunk flexors. That is, spinal muscles has got flexors and extensors. The muscles which works front of the body is flexors. The muscles which are working back of the body is extensors. Back of the trunk is extensors. So flexors के लिए अभी जितना भी exercises है ना, whatever I taught you is for the flexors, trunk flexors. Then we are going to teach them. I am going to demonstrate you the exercises in prone lying. That is, you are lying on your abdomen, and which is mainly for the spinal extensors, back extensors. Now the ideal position to perform the spinal extensor is you keep the both hands front. So this is the position. So in this position, and the grade 1, again the spinal extensors are also grade 1, grade 2, grade 3. So I am going to teach you the first grade 1, then followed by grade 2, grade 1 for upper trunk, grade 1 for lower trunk, then progression of combination of different segments. So which I already told you theoretically. Now the first grade 1 for spinal extensor for upper trunk is just lift your head and see the wall. Yes, 1. Yes, 2. 3, 4, 5. Then head along with one hand raising. 1, 2, 3, 4, 5. Change. 1, 2, 3, 4, 5. This much only is grade 1 for upper trunk, and grade 2 is head along with both hands raising. Yes. 1, 2, 3, 4, 5. Now the upper trunks grade 1, grade 2 extensor is over. Now for the lower trunk extensors. Now as in the same way as that of there's a supine lying, however I told you, the same way in prone lying, leg exercises related to leg will be strengthening the lower back. So now accordingly, straight leg raising. Yes. 1, 2, 3, 4, 5. Change. 1, 2, 3, 4, 5. This is grade 1. Then grade 2, bilateral SLR. 1, 2, 3, 4, 5. Now grade 2 we will be progressing with the combination of upper trunk as well as the lower trunk. For that we always practice the contralateral SLR. That is right upper limb, head and left lower limb raising. Crossed extension. Yes. 1, 2, 3, 4, 5. Change. 1, 2, 3, 4, 5. Now this is grade 2. Progression combining the upper trunk and the lower trunk. Then grade 3. Grade 3 for spinal exercises for complete spine is both lower limb, head and shoulder, both upper limb, head and shoulder, and both lower limb raising. Yes, all 4 limbs. 1, 2, 3, 4, 5. Now come to this supine line. So the spinal exercises will be always beginning from the breathing exercises and ending also from the breathing exercises. In the beginning, when we do the breathing exercises, it will be working in the form of warm-up exercises. In the ending, it will be functioning as a cool-down exercises for the spinal muscles. Now once again bend both the legs and do the breathing exercise for 2-3 times. Dear viewers, once again, as a conclusion of this small video, I wanted to tell you that these are the some kind of spinal exercises you are supposed to do in order to continue your aging life, that is aged life normally. So the exercises whatever you have seen, it is only for the people who does not have a significant symptoms of like back pain, neck pain, जिसको नहीं है वही लोग ये व्यायाम के लिए कोशिश कर सकते हैं. जिसका if somebody is having a significant complaints like neck pain, back pain, you have to get treated first with the hands of a physiotherapist. Then physiotherapist will tailor you what kind of graded exercises you may be required to continue, and from his protocol, if you follow it, and I am assure you that whether you are asymptomatic or asymptomatic individuals, and you are going to be completely normal with the help of this kind of a simple exercises which will be administered by the physiotherapist, and you will be learning the exercises meticulously, following all the simple techniques, all the simple principles that is being taught by your respective physiotherapist. So with this, I hope this video will be useful for all of you, and wishing you all very happy life. And if for your any queries, you can call me with my phone number. My phone number is 9890075216, and you can mail me with mail ID of course we are going to type in that now. So it will be displayed in the videos also, my details, and you can contact us, and I'm always at your service. Thank you very much for your spending your valuable time for watching this video. Thank you very much.